Hi, I'd like to welcome everyone in the room as well as all the folks who are online from across the country. I think we had about 75 or 80 people who registered for the webinar from coast to coast. My name's Devin McFarlane, and I'll be telling you more about myself in a moment. In the meantime, I just wanted to thank you for joining Rainbow Health Ontario along with Sherbourne Health Centre here today at the University of Toronto for a launch of the Trans Primary Care Guide, which is a new interactive resource to support healthcare providers in caring for trans patients. We're really excited about this new resource. I'd like to begin by acknowledging that we're on the traditional territory of the Haudenosaunee people, and most recently the territory of the Mississaugas of the New Credit First Nations. The territory was the subject of a dish with one spoon wampum belt covenant, an agreement between the Iroquois Confederacy and the Allied Nations to peaceably share and care for the resources around the Great Lakes. This territory is also covered by the Upper Canada Treaties. Today, the place of Toronto, from the Haudenosaunee word Karanto, is the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work in this community and on this territory. My name is Devin McFarlane, and I serve as the Director for Rainbow Health Ontario, which is a program of Sherbourne Health Centre. Rainbow Health Ontario works to improve the health and well-being of LGBTQ people across the province of Ontario and to increase access to competent and LGBTQ-friendly health care services across the province. We do this by providing education and training to providers, working towards public policy change, sharing information, and consulting with service providers and organizations. I also want to recognize our funders in this work. Rainbow Health Ontario is primarily funded by the Health Equity Branch of the Ministry of Health and Long-Term Care, and we also receive some funding through the Toronto Central LIN. I particularly want to note that Shannon Jeffries with the Health Equity Branch is in the room right now, and that Joanne Thanis will be joining us in a bit. Rainbow Health Ontario has previously been funded by a different branch of the ministry, and we moved to the Health Equity Branch just in June, which is for us, a very profound move, and we really appreciate that. We're really appreciating this support for our work, and it's great to have reps from the ministry here today. Part of introducing myself also involves letting you know what pronouns to use to refer to me. The pronouns I use are male pronouns or gender-neutral pronouns, so either he and him, or they and their. You'll hear all of our speakers today let you know their pronouns along with their names and titles. Some of you might wonder why we're doing this. We do this because it's part of respecting people's gender identities by using the pronouns they want to have used to refer to them. For healthcare providers, taking care to not assume people's gender identities and sexual orientations is one of the ways that we can build trust and increase patients' comfort levels and confidence with you. And that can improve your capacity to serve LGBT communities. For us at Rainbow Health Ontario, we encourage everyone to share their pronouns as a way to normalize this. This ensures that trans folks and gender diverse folks aren't singled out, and it's just a good practice to be respectful. So given that, I now want to move on to the focus of our gathering today, which is the new online interactive tool, the Trans Primary Care Guide. This interactive tool is based on the trans health guidelines and protocols developed by Sherbourne Health Centre that were first made widely available in 2009 and then revised in 2015. Many of you may know that the Sherbourne guidelines are used around the world by healthcare providers, so they've had very significant impact. Last year, Rainbow Health Ontario was approached by Kelly Speck, a student at the U of T's Biomedical Communications program, to explore using these protocols as the basis for an online interactive tool. So Kelly initiated the work that we're here to celebrate today. And without Kelly, none of this would have happened. So Kelly designed, developed, and built what we're going to be showing you in a moment, and she did an amazing job. So Kelly, thank you very much for this. For our part, Rainbow Health Ontario and Sherbourne, we provided some content and subject matter expertise to support this project. Jordan Zaitso, who you'll be hearing from shortly, was a content supervisor for the guide, and another person who was instrumental in the guide's development was Donna Turner, a former RHO communications team coordinator, who I believe will be here with us shortly. As well, I wanted to recognize a couple of the medical experts who provided advice on the guide, who are here today, Dr. Amy Borns and Dr. Ed Kucharski. What we're hoping for with this guide is that it will be a very practical tool for healthcare providers that gets people the information they need quickly and accessibly, and supports people to confidently provide care for trans patients. So on behalf of Sherburne Health Centre and the team at RHO, we're incredibly proud to have partnered with Kelly to bring this to life. So right now what we'll do is we'll be hearing briefly from Dr. Lizzie Hancock from Sioux Lookout. She will be joining us to tell us about her experience in using the guide. Dr. Hancock provides primary care to local people, as well as to more people living in more remote and fly-in communities in the Sioux Lookout area. She is newer to trans health care, having begun this work in the past few years, and has been initiating local efforts in the northwest part of the province to establish affirming practice and safer spaces for local members of queer, trans, and two-spirit communities. So, Dr. Hancock, over to you now.
Perfect. Well, good afternoon, everyone. My name is Lizzie Hancock. I use she, her pronouns. As was said in the intro, I work up in Sioux Lookout, and I also fly up to Deer Lake First Nation, which is where my primary family practice is located. And yeah, I'm very new to trans health. I acquired a transgender patient and then thought, well, maybe I'd better learn something about this. And as a rural family doc, I am pretty accustomed to looking things up when I don't know what I'm doing, because that happens all the time. But I have to say, like, Rainbow Health Ontario in general has been incredibly valuable for my learning curve around this issue, because I basically found the Sherburne guidelines and realized that almost everything I needed to know was right there in one spot, which was amazing. And then I got connected with the weekly mentorship phone call, which was also invaluable, just for having the kind of support and expertise of people who've done a lot more of this work than I have. So the website is a wonderful addition to the tools that are already being provided by Rainbow Health Ontario. I've used it only a little bit, but I found it really very user-friendly. The one thing about the Sherburne guidelines is that they are like a 72-page document, which I know some people find a bit daunting. So being able to just go to the website and easily access the portion of the guidelines that you really need in the moment is really great. And I used it in the room with a patient the other day. We pulled up the picture of the body with sort of hormone changes and discussed it. So it was super helpful. And I'm looking forward to using it more in the future. Thanks very much, guys.
So I just want to extend another huge thanks to Lindsay for that really generous testimonial. And also, Lindsay is one of hundreds of providers that are currently in our networks of primary healthcare providers in the province that are doing trans care. So it's just been absolutely wonderful and an honor and a privilege to sort of work alongside her and other providers as they're building their profile around doing trans healthcare and doing this work. So yeah, thanks again to Lindsay. So I'm Jordan Zaitso, and I'm one of the coordinators of Trans Health Connection, which is a program of Rainbow Health Ontario, and my pronouns are he and him. Trans Health Connection has been partnering with primary health care teams across the province to really build capacity around doing trans care. And we've been doing that mostly through comprehensive, often CME accredited training and education. So we'll go out and partner with different health centers to offer that training. And we support that training and education also with a number of other tools. So we do mentorship, we support community of practice and networking. We support organizations to review their forms and their protocols. And we also help on the other end as well. So we're connecting regularly with trans folks, with their loved ones, with their families and their parents to support them around their advocacy efforts and also to support them to connect to healthcare resources in their community. And I guess what I really wanted to say today is that I feel like really serendipitously lucky to have somehow been at the right place at the right time in this job to be witnessing what I would really describe as a glorious sea change in terms of healthcare access, but also kind of more importantly, like attitudes of healthcare providers in Ontario. So when we started the project 5 years ago, the landscape of trans health services was not really robust. There were a couple of different clinics that were doing trans care, and as a result, what we were seeing was largely like a migration of trans folks from their communities into larger urban centers where there was this sort of hope that they'd be able to find community and services. And that model was obviously creating tremendous problems. For one, it was creating this issue where services had a demand that far exceeded their capacity. And so folks were coming to the cities and still not able to access the care that they needed. And the other piece was that folks were essentially having to leave their communities in order to access sort of basic primary health care. And so the sort of two core messages of the program have always been, one, that trans care is not specialty care, it's not specialized care. This is really within the rubric of primary health care services, and we really see it within that scope. And like hopefully our goal is one day that we will be able to sort of support every primary health care provider to build some core competencies around doing this work. And the other piece is that trans folks should never have to leave their community in order to access care. So really trying to expand and support providers everywhere in the province where that support is being sought for, to really connect with them and get the supports there so that they can do this work. And so that's kind of like the big hopes of the protocol document that Sherburne created, and of course the hope of this tool. And I actually want to share a little bit about the mentorship call just for folks. I know we have a lot of folks on the webinar right now. If you are a healthcare provider in Ontario or who is either working with trans folks and gender diverse folks or thinking about doing that work, we have a weekly teleconference that we host through Trans Health Connection every week on Wednesdays over the lunch hour. It's an opportunity to call in and get support around your clinical work with trans folks. We have a panel of mentors that are sitting on that call every week, including physicians and nurse practitioners and psychotherapists and others. And you can call in and just chat. You can call in and find other providers in your region that are doing trans care. You can call in with questions, or you don't even have to call in at all. You can just get on the listserv, and we're circulating up-to-date information about trans healthcare there. So it is a way, especially if you feel like you don't have a community of practice around doing trans care, it's a way to get connected. So I invite anyone who's on the call and working in Ontario to join the call. We would love to have your voices there, and we would love to work with you. So I kind of want to hold these two things together, the two things being that we know that trans folks continue to experience tremendous barriers in terms of accessing healthcare services, and that has to do with the sort of legacy of erasure and mistreatment in healthcare settings, and that sort of legacy is not easy to turn the tide on. And I also want to say that I think that providers in Ontario have done something phenomenal in the last couple of years, and how I've seen that again and again, because trans healthcare is not taught in any professional program, so nobody's entering the field as a trans health expert. So really seeing these leaders or these champions of trans healthcare step up and say, yes, I will do this work, and really do that learning, has been invaluable to witness. And to hear those stories also in terms of the impact on their practice from doing this work has been really heartwarming. So again, I just want to extend gratitude and just a lot of love for that process and what I've seen from healthcare providers stepping up over the years. So when we do training and education across the province, the document that we're primarily using is the Sherburne Protocols. It's actually called the Sherburne Guidelines and Protocols for Hormone Therapy and Primary Healthcare for Trans Clients. And that was a document that we built the interactive tool off of. And so Kelly's work has really been about bringing that tool to life, really making it this animated, interactive, exciting thing to engage with and to do that learning with. And of course, make it even more accessible for providers to take that information in, and also for trans folks to have access to that information in an accessible and visual way. So it's really been, it's really just been a phenomenal project. And I want to nod just quickly to the folks, again, who have been a part of this. Kelly, obviously, and Kelly worked very closely with Donna, who was the communications coordinator at RHO during that time, and Donna really scoped the project with Kelly and saw it through all the way almost to the end, and was just so tremendous, as well as other staff at RHO and the clinical team at Sherburne, who not just wrote the protocols but also contributed significantly to the content of this guide. and also the community and provider consultations that Kelly did. So such a thoughtful and collaborative process around what to make interactive and how to use the images and what those images would look like. So the tool that Kelly is going to show us is really a result of all of that collaboration. So yeah, I'm going to hand it over to Kelly now to walk us through the tool and show us some of these exciting details. And so she'll do that for a little bit, and after that we'll have a quick Q&A. So hold your questions, or I guess you can type in your questions as she's going, and we'll have a Q&A about the tool at the end. So welcome, Kelly.
Hi, everyone, here and online. I'm Kelly, as Jordan mentioned. I go by the pronouns her and she. And I am the one who collaborated with Rainbow Health Ontario and Sherbourne Health Centre to create this online guide. My background is in biomedical communications, so technically we're medical illustrators, but we're trained to take complex scientific or medical information and use visual or interactive technologies in order to bring them to target audiences. So when I started doing my research on transgender health, I was very shocked about the amount of barriers that were out there currently when I had started doing my research, and really fascinated by how much effort Rainbow Health Ontario had already put into decentralizing this expertise that had been growing in Toronto across the province. And this was really drawing on my training in biomedical communications and trying to find a topic for my master's research project. I saw an opportunity to use interactive technologies, illustration, and biomedical communication to bring these guidelines and protocols to life. And so the nature of this information, trans journeys, they're very different. They're very individualized, and I had a hard time trying to come up with a very linear process that most providers are used to in terms of e-learning. So mapping the different journeys for trans clients through the medical system and potentially all the care that they might need in their pathways was really well suited to this non-linear interactive format. And so because I don't know how many people have actually seen the guide, I'm going to walk you through it step by step and kind of show you what I mean by non-linear. Okay. So the homepage is basically set up with 2 buttons because we knew that this topic is, up until that point, it hadn't been covered in medical school. So healthcare providers, primary care providers, they were coming at it from different points of knowledge and expertise in the field. So we wanted to create 2 direct entry fields. One, I'm not familiar at all with trans health. Might even be people who don't even know what the word means or what that all entails. The second one is more people who might have already had trans clients in their practice and they just want to get at specific information from, for example, the guidelines. So let's start with I'm not sure what trans health means. So in the menu, you have the introduction section that is built up into 3 kind of introductory sections. And I'm just going to walk you through them quickly. So the first one, common terms, is basically going over important terminology or language that you should be aware of. Language is very, very important in this field, and it can make somebody feel more welcome depending on the language that you use. So this is just basically a list of common terms. The second part is urgency of medical care. So there's certain things that I felt profoundly distressing, the research that I had done on trans health and the barriers that exist and the history around it. So this is really just because I met a lot of primary care providers and this was not known. And I think if people learn more about barriers that had existed and how difficult it has been, then maybe the motivation to welcome trans people into practice would be larger. So this is basically, you can go through and explore research that had been done in the field, for example, on suicidal ideation and attempt rates, and it's interactive in a way that you can explore the different rates, and they're compared between trans and cis Canadians. There's also a little bit more information on what the barriers to care are currently or in the past. And it's basically a linear story that you can walk through. The third section is an overview over the services offered. So a lot of these services fall, well, most of them fall within the primary healthcare realm, except for surgery. But what I found was a big misconception through learning the topic myself was that people thought it was a linear process that ended in surgery, and that's typically not the case. So I wanted to visualize a way that a provider can click through and actually see the multiple different options that are available to clients. So here, for example, you can click on the actual section, and it'll update in the bottom on what, or actually on a big screen, this would be side by side, and it'll tell you what that section of the journey would be. For example, as a primary care provider, if I wanted to see medical options, there's hormone therapy or surgery, and under hormone therapy, it gives me kind of an overview what hormone therapy entails. And from here, I can access the guidelines and protocols directly. And this would get me back to the point in the beginning that, I mean, some primary care providers are entering the guide already knowing what they want, already knowing that they want to get direct hormone therapy guidelines. So they can go directly into the guidelines and protocols and either choose initial assessment, that is to learn how to, for example, new or newly transitioning clients that come into your office, how to provide hormone therapy care and assess them. And the second and third is basically the two feminizing and masculinizing hormone therapy. So for the initial assessment tasks, this is also fairly non-linear because it's not like a set guideline, a checklist that you can check off, basically. So these are initial assessment tasks that are mentioned in the guidelines, and we essentially put them online, but added illustrations to show care providers situations to help them envision possible encounters with clients and teach them cultural competency skills. So a lot of the images have buttons where you can click. For example, if it's a conversation that you need to or should be having with a client, you can have potential questions to ask. Or if it's something that has to do with a initial assessment task around a medical, clinical-oriented thing, there's language that is suggested in these pop-up questions, pop-up buttons that you can use. And so this kind of explains the different tasks highlighted. And then in the third part is where you actually get into the feminizing hormone therapy. This will walk you through the basic hormonal agents as well as the expected effects of hormone therapy. And we also have interactive parts to this where you can basically, here's an illustration of a body, and you can hover over these or click on them in order to see if that effect is reversible, or if what approximately the expected onset and maximum effects are. And this is again highlighted in this table where you can see the green is kind of typically when an effect starts, and the purple is where the maximum effect typically starts. A thing to highlight is this is very individualized, and this is not for every client, but we wanted a way to have providers possibly talk to their clients about expectations and what they, are hoping to see, changes they would hope to see. So let's go back. Oops. For the masculinizing one, it's the same thing. It goes over the expected effects. And then it also goes over some of the, each section goes over some of the risk factors as well. So you can click through and have some of the key risk factors highlighted, as well as how to minimize them. One last thing that I'd like to point out is that in the resources section, what I've been doing with Sherborne Health Center in collaboration with them is trying to conglomerate the information from the protocols and guidelines into a quick reference guide, and this is something that Dr. Amy Burns had really wanted to do early on. So I'm glad we continue to work on that, and they can be downloaded from this resources section, and they give you a quick overview of all of the important steps, for example, the initial assessment steps, or the feminizing and masculinizing hormone therapy, which formulations and recommended doses there are, what the precautions are, kind of like the essential need to know things. And these types of resources are online on the website under the resources section, or throughout. There's certain sections that you can easily click and download, and it'll open on a separate page, and you can print that and put it in your office, or just use it as a quick reference. So again, back to the resources page, there's point of care guidelines, there's hormone monitoring summaries, and all of the individual sections that you needed for quick reference are there to download. Another important thing that is highlighted in the initial assessment is that you're also there to consult. You're not just there to consult your client, but you're also there to advocate for them. And so a lot of this advocacy revolves around things like consent forms and support letters, and all these documents that are added to the protocols and guidelines have already also been added to the online website so that they're easily accessible. One of the things that I wanted to mention before I hand it off is that Jordan touched upon it a little bit in the beginning of how in the design and development of this resource, because we were dealing with visual communication, and this is a very sensitive topic. So how I initially approached this topic is by getting feedback from my committee, from Rainbow Health Ontario, from physicians, content experts, and my committee. And then the second very crucial step was going out into the trans community and actually asking trans clients what they think about the illustrations that I had provided. So early on, illustrations that I had made, draft illustrations, were reviewed in an online survey by, I think, around 50 participants evaluated them, and that's how they were decided on which ones to include. Similar for the expected effects, the body illustrations, they were also evaluated by the trans community. And then as a second step, I built an online prototype that was then evaluated by primary care providers. So there's been a lot of iterative development in this tool, but I'm happy to see that it's being launched and used.
Thanks, Kelly. So we wanted to... Was that clapping? Yes. Yeah, clap it up. It's really exciting. And I've browsed through it so many times, but the way that you know it so well, like the back of your hand, I was like, oh yeah, you can just pop it up like that. Anyways, that was really exciting to watch. It's like a mad dash through that whole guide. So we wanted to leave ample time for Q&A for folks here, and also, of course, folks who are signed on via webinar. There are many of you there. And just a couple of caveats before we do that. One, neither Kelly nor myself are medical providers, so if you have questions about the guide, how it's structured, some of the decision-making around it, the images, the functionality, all of those things, please do ask them. If you have questions about the content of the guide, please come to one of our trans health primary care sessions, and we will discuss it there, or we can connect you with providers at a later time or through the mentorship call. So I'm going to turn it over to folks if anybody online or in the room has questions. So we see a couple here, and I don't know if you have any coming in there yet.
I just have a question about if you're not a primary healthcare provider, but an allied healthcare professional, how can this guide be used to support, like, working with folks who are trans and gender variant?
Okay, go
So just from speaking to a number of different providers that are already using this, like it's definitely not just physicians and nurse practitioners and registered nurses that are using it. Lots of different providers are using it, and trans folks are also going online and taking a look at it themselves. So I think that because of the sort of interactivity of it and the visuals, and a lot of it is like quite accessible language and quite accessible to move through, I think that it can be a great tool in lots of different clinical settings, and for folks to just read on their own to get like a comprehensive sense of like healthcare options and pathways for themselves. So yeah, helpful for medical providers who are doing this learning, and also helpful for trans and gender diverse folks to like sort of up their advocacy game and knowledge around potential options and pathways. So lots of folks will have it open and go through the guide with people and sort of help them move through some of the content and get a clearer understanding around like expectations or pathways or options for them. So yeah, we've heard from folks who have been using it in lots of different settings. Yeah.
Just wanted to take a note. If you have any feedback to give, we're conducting a feedback survey. So anyone online or in the room, if you've used the guide before, please go to the Trans Health Connection page and take our survey. It only takes like about 20 minutes, but it'd be really helpful for us to know if people are using it and how they find it, how effective it is.
Somebody would like to know, Rob would like to know when the guide will be updated, or as a clinician, how can they contribute to future revisions?
Future revisions for now is definitely take this survey. Oh, do I go over there? Oh. Future revisions, definitely this button for the survey, we've kind of placed a feedback survey and an evaluation survey on the Rainbow Health Ontario Trans Health Connection page. So if you have immediate feedback, please give it there. In terms of the resource, Rainbow Health Ontario and Sherbourne Health Centre are taking over the resource, and it's hosted on their webpage, so any further developments will be in their hands. Yeah.
Hi there, Ed Kachar. Is this working?
Sorry.
Can you hear me?
Yeah.
Ed Kaczarski here. I'm the LGBTQ faculty lead for the University of Toronto interim, covering for Dr. Amy Burns, and I prefer he and his as my pronouns. I've had the good fortune of working at Sherbourne for a number of years, and actually I was thinking about this last week, and it's more of a comment, sorry, it might be a little bit long-winded, but I ran into Leslie Shanks, who is the medical director at Sherbourne when it first started, I think in 2001, and I'd never met her before, and I was thinking about this guideline online, and she actually wrote the first Sherbourne guidelines, which were kind of the unofficial guidelines. And I remember as a student and as a resident learning about trans healthcare that we had these kind of covert photocopies of the guideline that were just a Word file that said draft. And I don't think they were ever official Sherbourne guidelines. And it's interesting to see how far we've come. And Devin mentioned that the guidelines were revised in 2009 by Dr. Kate Greenaway with the intention of making them more accessible and putting them online. So I think Leslie Shanks, who is that first author of the guidelines, would be beside herself, and I actually am going to send these to her to see them online in such a wonderful format that our patients can use, as well as our clients and other healthcare providers. So you guys should be really proud of yourself and the work that you've done, so congratulations.
Thanks, Ed.
Thank you.
Am I butting in if I ask a question now? Okay, it's actually, I have a comment and a question. I just first wanted to say a big congratulations. This is absolutely amazing. I was sort of involved in the project in its infancy, and I sort of saw the ideas coming together, and it's actually a really neat, unique perspective to have been on mat leave for several months and come back and see this project in its final form. And I guess I should introduce myself. I'm Amy Borns, and she, her pronouns. I also had a question because I haven't been all that involved over the last several months in the evolution of this project. And I was curious, Kelly, what you found, if any major themes emerged from the feedback that you got from the trans community. I'm just curious what the response was and what major changes that came out of that consultation process.
Yeah. So a lot of the initially, so the feedback that I had given to online participants, it was an online survey. So it relied on one, the heavy area of focus where I had a lot of illustrations and a lot of visuals was the initial assessment guide. So I had a lot of draft these conversations between provider and clients that I had drafted up and had people comment. And on those, it was really trying to nail down, I want to say, the dynamic between the provider and the client, because even inherently as an illustrator, I was channeling certain things through that, and I think especially the dynamic in transcare is so much more important to visualize, that it's a lot of times providers learning from clients. And so there were comments like that came up that asked me to emphasize that more, that put the provider in a listening situation rather than in a talking situations. And they're really nuanced, and I think you wouldn't pick up on them if you were just scrolling through the guide, but I found that really helpful to hear from them what their experiences were, and they wanted that reflected in the guide. And secondly, the more technical illustrations, I want to call them, they were for the expected effects of hormone therapy. And for that, I started out with, I think, 4 separate illustrations for each the feminizing and the masculinizing sections. And in the end, we decided together on 2 sets of illustrations. And then we had the community decide A or B between the illustrations. And that was extremely helpful. And I was a bit wary in the beginning because I thought the response would be kind of 50-50, but it was overwhelmingly 90-10. So it was really easy for us to say, okay, this is the route to go. And what really struck me as important there was less them commenting on the illustrations, but more on the language that was being used. Because why I'd included trans people in this first line of research was, and first line of feedback was because they would be viewing the resource, even though they're not the target audience, they would end up seeing it in a doctor's office, at home, because it is widely accessible. And so it was really important to hear them pick up on nuanced little languages that were used in the expected effects of hormone therapy, and that we ended up, changing to make it more vague or more to take out that incidence of somebody being not feeling welcomed or not feeling respected by reading it. So that's definitely really helpful to hear from them. Yeah.
So I think it's a really important part of any work like this to be consulting with the community, and we will do our best to continue that process as this website continues.
And I'm sure for everyone listening, there's language that was set for the guidelines when they were wrote, and that will inevitably change. Language will evolve, but we can make an effort of making somebody feel comfortable in the moment right now, and do our best to do that as best as we can. So,
excuse me. I had one, probably the last question looking at the time, though we may have time for another one. Kelly, I was curious what you would describe as your biggest learning in this initiative.
I think I could bore you with the details of the technical challenges, things that I've learned in designing and developing this guide, but I think the biggest learning curve for me was these community academic partnerships, how important they are, because we can really highlight barriers to care that are out there in the community right now, and we can create things that will actually change if we use the expertise that we have in the academics to discover these health problems and then work together with the community. With this project, it was really unique because the expertise really lied in the community and not in the academics. And so it was so essential. I could not have done this project without the collaboration with Rainbow Health Ontario and Sherbourne Health Centre. So really bringing those 2 fields of expertise together. And I think for me it was coming from a very interdisciplinary field of medicine and art together. It was very natural for me to go out and approach Rainbow Health Ontario with this. But I think that was my biggest take-home learning curve, was to try and foster those kind of collaborations more in the future. Yeah.
So thanks everyone for your questions. For the folks who are online, thank you so much for joining us. For me, I'm so excited about this tool. It represents such a step forward in terms of what we're able to do and provide as support for clinicians, whether people are working in primary care, people are working in more mental health and social work fields. I'm really excited about it. So again, thank you everyone for attending today here across Ontario, across the country, who've been joining us for about this, and we're really looking forward to finding ways to support you as we go forward with this. And just another plug for the survey, if folks have a few minutes to fill that out, that would be great. Also, as I mentioned earlier, we'll have a recording up of the video session soon, and we'll get that a link to that out via email, as well as a link to the survey for the feedback. So for what we're going to do now is we're just going to move into wrapping up. So for folks in the room, we'll be moving out to a reception in the hallway where we'll have some food and refreshments. And for the folks online, we're going to sign off. So again, thank you so much for your time and for joining us in this. And please spread the word about the tool to your colleagues, wherever you think would be helpful, so that we can provide better care for trans folks. Again, my name is Devin McFarlane, the Director for Rainbow Health Ontario, an initiative of Urban Health Centre. And if anyone has any further questions or comments, you can reach us at info@rainbowhealthontario.ca. So thank you. Bye.